My dear students, hope you're doing well. Let's start today's session with something interesting. We'll quickly dive into today's topic. Before that, let me ask you a few questions. Why don't bones break even though they are live? Have you ever wondered why children get green stick fractures instead of complete ones? Let's try to figure out answers for all these one by one. Why are bones considered as a connective tissue? Because they consist of cells, that is osteocyte, osteoclast, and so on and so forth. They are embedded in an extracellular matrix, which consists of ground substance, collagen fibers, deposited with minerals that connect, support the body structures, fulfilling the definition of connective tissue. So cartilage and bone, blood, all these are connective tissue. These can be called as specialized connective tissue. Why do bones appear hard and rigid compared to other connective tissues? Due to mineralization of the matrix with calcium phosphate crystals, mainly hydroxyapatite, which gives rigidity and compressive strength. Collagen fibers, they are going to be filled with the calcium salts, phosphate salts in between the collagen fibers and the hydroxyapatite crystals makes the bone hard. Why is bone considered a living tissue? Because it contains living cells like osteoblast, osteocyte, osteoclast that continuously remodel the bone, unlike inert materials. Why do bones heal after a fracture, but cartilage does not heal well? Bone is vascular, which has got rich blood supply, allowing active cell division and nutrient delivery for repair, whereas cartilage is avascular and relies on slow diffusion. So when there is a fracture, after the fracture, a soft callus is formed in a bone, hard callus, and last the remodeling occurs and the fracture heals. Why are bones hollow in the middle? That is, the bones have a medullary cavity inside. So it reduces the weight of the bone while maintaining the strength. Similar to an engineering principle where a hollow tube resists bending better than a solid rod of the same weight. So imagine a tube which is placed on two pillars and a weight is applied from above. So the weight is considered as a compressive force, and from below there is a tensile force applied. So both the force will be nullified at the center. That is called the neutral axis. That is where the bone has a narrow cavity. So removal of the neutral zone does not going to affect the strength of the beam or the bone. Why are flat bones like skull bones formed by intramembranous ossification? Because they develop directly from mesenchymal membranes. This allows rapid formation of protective flat plates for vital organs such as brain. That means brain required a covering as early as possible as the development goes on. That is possible through membranous ossification, whereas cartilaginous mode of ossification takes time. Why do children's bones break more easily but heal faster than adults? Their bones are less mineralized and more flexible, maintaining them prone to green stick fractures, but their high cellular activity and rich blood supply promote rapid healing. So, what is a green stick fracture? It is an incomplete fracture of a bone in which one side of the bone breaks and the other side bends. So one side is broken, other side is bent. Much like how a green twig bends and cracks but doesn't snap completely. Why are epiphyses of long bones spongy, not compact? Spongy bones absorb shock and distribute joint pressure efficiently while reducing overall bone weight. So the epiphyses, both ends of the bone, are spongy in nature. Why does osteoporosis commonly affect the vertebra and neck of the femur? These regions have a high proportion of cancellous, a spongy bone, which is more metabolically active and more prone to resorption. Why is periosteum essential for bone growth and repair? Periosteum contains an outer fibrous layer and inner cellular layer, which is basically osteogenic cells that form the new bone, and its blood vessels nourish the outer bone layers. Why do bones have different shapes? Long, short, flat, or irregular? Each shape is adapted to its function. For example, long bones act as levers for the muscle attachment. Flat bones protect the organs like brain. Short bones allow limited movements, like in the wrist, and irregular bones, the vertebra, that has mixed roles. Why is bones both strong and light? Because of its composite structure, that is mineral salts providing hardness, collagen fibers give tensile strength, and trabecular arrangement that minimizes the weight. Why are fractures more common in old age? Aging reduces bone mass, that's called osteopenia, and collagen content. That further leads to osteoporosis later, making the bones brittle and less resilient. This is a healthy bone, this is the osteoporotic bone. Why do bones need to remodel continuously? To adapt to the mechanical stress, repair, and micro damage, and maintain calcium homeostasis through the coordinated activity of osteoblast and osteoclast. Osteoblast produces the bone, osteoclast remove the bone. Why are bones richly supplied by blood vessels and nerves? Blood vessels supply nutrients for growth and repair. Nerves carry pain sensations, that is important in injury, and regulate vascular tone. Why is shaft, that is diaphysis of long bone, made of compact bone? Compact bone provides high mechanical strength and resist bending forces experienced during movement. This area is compact, right? Compact bone. Why do athletes and manual laborers have thicker bones? Because bone remodels occurs according to stress. That's called Wolff's law. Mechanical load stimulates osteoblastic activity, leading to increased bone density. Why do astronauts lose bone mass in space? Absence of gravity reduces mechanical loading on bones, leading to bone resorption, as in this diagram. So it exceeds the formation of the bone. That means the bone resorption is more faster than the bone formation. That leads to uh, loss in mass of the bone. Why is bone marrow red in children but yellow in adults? In children, active hematopoiesis requires red bone marrow. With age, it is replaced by fat, that is yellow marrow, as the demand for blood cell production decreases. Why are sesamoid bonds like patella embedded within the tendons? Patella or sesamoid bond that reduces the friction, alter the direction of muscle pull, and increase the efficiency of muscle leverage. Thanks for listening. Best of luck.